Internet and broadband service is critical to our healthcare system here in Northwest Alaska, whether it's at the Village or in Kotzebue or in Anchorage at Alaska Native Medical Center. It's the backbone of how we transmit patient health information.
The internet is so important in our position in the villages because if it goes down, it could be deadly, not just because of allergies and medications. It's the way that we diagnose people.
I would say the internet is extremely important in what we do because it allows us to review information about patient care and patient needs without actually having to go to a remote location within the Alaska wilderness.
Here I could teleconference with my doctor, and if I have any questions, he will get the answer right away.
It's a huge benefit because I see and I talk to my provider more often than I do or than I did before. I saw my old provider only twice a year.
Just a time saver and save all my personal leave, and because the cost of living is too high to have to miss work.
Just this past year, the people who participate in the rural health program that's monitored by FCC reached the cap of $400 million. Previously, that wasn't an issue. Now that there's so much use because everybody wants to subsidize their broadband, there's been a cap. They've hit the cap this past year.
In order for us to give the proper care to our patients, we do need help to subsidize this internet and the cost of it. It would bring so much money out of our budget to upgrade our internet system that it would take money away from other services that our corporation or our association could provide for our patients. Everything uses internet, and it's so cost effective to be able to keep internet rather than having to transport every single patient on an airplane up to 500 miles away just to get proper care.
So we're asking the FCC to consider language, legislative language that would lift that cap and allow tribes and other programs who take advantage of USAC to continue to be able to rely on their funding to help us supplement our broadband.